Hello, and welcome to the Mama Podcast. On today's episode, we sit down with Elif Ege, the Policy and Campaigns Manager at Birthrights, a human rights charity advocating for respectful and equitable maternity care across the UK. Elis and Heidi dive deep into the importance of human rights in childbirth, sharing insights from Birthrights' amazing campaigns, especially their latest work on home birth restrictions. They discuss systematic racism in maternity care, the critical issue of home birth access, and what women, birthing people, and healthcare professionals can do to champion meaningful change. Join us now for an inspiring and empowering conversation.
Well, hello everyone, and welcome to this episode of the Mama Podcast. I'm Heidi Eldridge. I am the host and the CEO and founder of Mama Academy. So thank you so much, Elif, for joining us today. I'm really excited to have you on and learn so much more about Birthrights. So let's get straight into it. Please introduce yourself, tell us all about you and how you started working for Birthrights.
Thank you so much. Thank you for having me. I'm very excited to be a guest and to talk about Birthrights and our new campaign. My name is Elif Ege. I'm the Policy and Campaigns Manager at Birthrights. I'm originally from Turkey. I've been working at Birthrights since last year, January, so a little bit more than a year now. And I now feel like I know a lot more on the maternity care system and the UK context as well. Thanks again for having me. About Birthrights, I can start by saying that we are a human rights charity. I'm very proud of the story of Birthrights. We were founded by a human rights barrister and a doula, and we are a human rights charity that brings human rights lens to maternity care. We advocate for and protect the rights of women and birthing people during pregnancy and birth in all around the UK. International human rights law and UK law constitutes the basis of our work, by which we mean is that every woman and birthing person have a right to choose where they want to give birth, how they want to give birth, and with whom they want to give birth, and they have rights over their bodily autonomy, choice, and consent. This principle constitutes the basis of our work. Birthrights has three main kind of branches of work. One of them is an information and support center we have, service we have. This is a service, this is an email service. So this is a service that women and birthing people and healthcare professionals can reach out to us with their questions about advice, about their rights, specifically about their legal rights. And we also provide trainings to healthcare professionals. So we are trying to analyze the system and improve the system from both ends with the information and support, and then also training the healthcare professionals. We train healthcare professionals to bring human rights lens to their practical work on a daily basis. And then my job is to hold the systems accountable and work for a systemic change by policy work, advocacy work, and campaigns. And one major thing about Birthrights is that tackling systemic racism constitutes the basis of our work. It's at the core of our work. So you may know this already, but in 2022, we published a report called Systemic Racism, Not Broken Bodies. And I really encourage the listeners to go and read that report, because it's unfortunately, it has been like almost 3 years now, but it is still valid, and it provides a lot of reasons, a lot of explanations to the reasons behind racial disparities in maternity care at the moment. And we are really focused on challenging this systemic racism in maternity care.
Wow, that is a lot of work and no mean feat
Yeah.
to
Yeah.
lead systematic change, But I've been following you guys for a long time now. We've worked together many years ago, and yeah, it's just fabulous to see the work that you're doing and the campaigning that you're doing. It's just absolutely brilliant. So I know your latest campaign is all about home birth restrictions. So tell us about that report and the key findings of the report.
Yeah, we decided to undertake this campaign based on all these growing reports of home birth restrictions and suspensions that we were hearing from women and birthing people via this email service, advice service that I just mentioned. We have been thinking about this issue mainly since September. Because notably since September, this was the largest proportion of our inquiries. And we were also, again, because we think about disparities and disproportionate impacts and equity, we were thinking a lot about how these restrictions and suspensions to home birth services were disproportionately impacting Black and brown women and birthing people and women and birthing people from marginalized communities. That's why we decided to undertake this. We were really kind of a little bit shocked to find that it's actually in human rights law, in Human Rights Act, in the UK law as well. Every woman and birthing person have a right to choose the place of birth. And we know that NHS trusts and ICBs are required to provide this right. But we were hearing about suspensions that were happening even since COVID, which means 3-year, 4-year suspensions. We were hearing about restrictions happening more than 100 times in a year, maybe. So what we have seen was that this is a right, Article 8 kind of specifies what this means for women and birthing people. But what we have seen was that very unproportional amount of restrictions and suspensions happening. That's why we wanted to, because we were hearing from women and birthing people from all around UK, but we really still wanted to know the scale of this, which areas we see these suspensions happening, and to what extent it's actually a reality. That's why we decided to undertake an FOI campaign, and we reached out to all trusts and health boards, 145 trusts and health boards all around UK who provide maternity services with our FOI questions. And in order to, we didn't want to be limited with the FOI responses, that's why we had 2 online surveys, one for women and birthing people and one for healthcare professionals, because we wanted to directly hear from women and birthing people, right? We wanted to hear the direct voices and their experiences. And then also we had a lot of different meetings with different community groups, dedicated home birth teams with healthcare professionals. These are all in addition to the data and information we have in our information and support service. So based on all of this, what's the picture that we had in the end, based on all this research, was that 119 trusts provided us enough information in their responses. And among them, 2/3 of trusts, at 2/3 of these trusts, services like home birth services are either completely suspended or very severely restricted, or frequently restricted. Like there are either strict restrictions or very frequent restrictions happening. So in 2/3 of these trusts, we cannot talk about a reliable service. This kind of confirmed our concerns that home birth services in the UK are, there's a widespread unreliability, and this is a very patchy service that we are talking about.
When I first read the report, I was really shocked by those statistics because I knew, during COVID, that a lot of the home birth services were restricted, suspended, etc.
Yeah.
But I really thought now, a few years later, that they were all pretty much all back up and running again. So those statistics really did shock me.
Yeah, exactly. That's what like you would assume, definitely. But like we always say this in other areas as well. And we had a campaign before on partner restrictions too, which was again like a remain of the COVID restrictions. And COVID kind of they set a dangerous precedent for the trusts. And it's getting really that's why we were concerned and decided to undertake this campaign basically. Yeah. I can talk about like some other because this is like a very obviously very difficult picture, this kind of unreliability, how common it is. But it wasn't just limited to that. It was very valuable to me that we were able to find out some other findings as well. So one major thing was the blanket policies about who can access to home birth services was a big like it's a big problem. There are local thresholds and guidelines on factors based on BMI, on the predicted weight of the baby, or on gestational diabetes that kind of lock certain communities and certain women and birthing people out of these home birth services and disable access to them. In addition to that, we have seen a lot on restrictions on when to be able to access to home births. Like trusts were saying that home birth services are available, but not in the weekends or not in the evenings or not for this specific geographical area, which is kind of impossible to plan, right? In that sense, like you can't plan your birth to be in work hours during work days, right? In the weekdays. And a very important thing for me, and I will talk more on healthcare professionals aspect, but big finding was on the widespread lack of adequate training for healthcare professionals to enable them, to support them, to train them on home birth. And lastly, the big kind of something that we heard very frequently was about the poor communication about these restrictions, because like it's better not to have restrictions or suspensions at all, but then it's very important to be able to communicate it effectively, properly, and in a very empathetic way, and try to find alternatives to women and birthing people requests. But what we have seen was that a lot of like last minute restrictions, just at the very last minute informing women and birthing people saying that home birth is not going to happen, just come to the labor ward, which is I will talk more on this, but which is creating a lot of impact on people. In terms of findings, just one small thing I just also want to add here is that people may think that, because also this is a question that comes to me a lot, like, why is this happening? Why can't trusts provide this service? And I did, because I read like all the FOI responses for like more than one time. What I've seen a lot was that first of all, I've seen this phrase like lack of staffing, like referred a lot, emphasized a lot by the trusts, but as a reason to these restrictions and services. But what's like we wanted to unpack this a little bit, and when you think about it, it's actually a lot about lack of planning by the trust, because we were hearing from women and birthing people saying to us that I informed my trust at the very beginning of my pregnancy about my like choice on home birth, they were saying to us. So we were thinking a lot about like, isn't there any other way to plan this ahead? And like lack of staffing is a big issue, systemic issue, we know that, and it has to be tackled in a systemic way. But in this case, there's actually a room for planning, and that is actually not being done properly. There is also a very clear and repetitive emphasis on dynamic risk assessment and safety. So the trusts were saying us in their FOI responses that, like, we conducted a dynamic risk assessment and we didn't think it was safe for us to send a midwife for a home birth. So that's why we encourage people to come into the labor ward. But it's very important, and recently we published a blog post about this as well, so I really encourage people to go and read that, because when, like, safety becomes a keyword, but like there's a need to be critically engaged with this word. And whose safety are we talking about? Are we prioritizing the safety of women and birthing people, or safety of the trust? Because if a person is telling you that there is no way for them to come to your to the labor ward, this can be due to many reasons. They may have a birth trauma before, previous trauma, any kind of other trauma in hospital, or they may have many other issues that is preventing them to come to the labor ward. And if she's telling you that she can't, but if you're not providing an alternative solution to them, it's actually, we are talking about, how can we talk about safety of women and birthing people, basically? So that's kind of something that we really have seen a lot, and we really think that needs to be tackled. Yeah.
And did you find that there was any particular geographical areas that there were more restrictions in? Did you find that there were any trusts that were able to offer home birth services really well?
Yeah, like, I wish we could find some geographical differences, but it's actually, when you look at it, is like all around UK. When we are talking about restrictions and suspensions, it is not just England, it's all around UK, in like many different areas, all at the same time. And there are really good, like, there are working home birth services, because there are dedicated home birth teams actually. They are able to, they have, like, not, usually it's not enough resources, but they have some resources to achieve a continuity of care, to see the same person, like one midwife sees the same person for over their pregnancy. They plan ahead, and if she wants to plan a home birth, they plan it together, and they do it until the very end all together. So those cases are always very important. But unfortunately, we are now seeing dismantling of these dedicated home birth teams, and kind of really just like destroying the infrastructure for a community-based care that's already there, that's already effectively working, towards the hospital, towards like shifting everything to the hospital, to the labor ward, unfortunately. Yeah.
Yeah, that's really sad if, that choice is
Yeah.
no longer available.
Yeah.
I'm thinking, I want to encourage parents to go and have a look at the report, because if they are hoping to
Yeah.
have a home birth, it would be good to see which hospitals are able to facilitate that and which aren't, to see if there are ones in their area that they could approach, because that would make a decision as to where you have your care.
Yeah. I should say that, like, we don't have that kind of an information on trust-based information in the report, but I encourage everyone to reach out to us. And then also I encourage everyone to still see this as an option, because this is still there. And I will talk more about this, but there are ways to challenge these restrictions. So if you, as a woman, as a birthing person, as a supporter of that person, if you are listening and if you are considering home birth, like, reach out to your trusts. But if you hear anything about, like, restrictions or suspensions, please, like, you can go over our report, you can go over our website. We have tools to challenge those restrictions and suspensions, campaign resources specifically for women and birthing people, like template letters to be used. We have fact sheets that you can actually copy and paste and use, like, base your argument upon, and you can easily say that this is my right, right. Birthrights say this in this fact sheet, and this is my right. I know my rights. So you can self-advocate. We really, really encourage that. And we have cases of people who achieve to get this right after all this effort. And also, I just want to remind people that this may not be the result, but still it's very important to think about this option, ask for this option, and then like pressure your own trust to provide these services to you. Yeah.
Absolutely. A second opinion on things is key as well, isn't it? Because you mentioned the reasons for some of the restrictions earlier about having gestational diabetes or having a certain BMI, and
Mhm.
we can have certain risk factors that obviously, we do need to weigh up the pros and the cons and have informed choice to make
Mhm.
that decision.
Yeah.
But if we want a second opinion, then we're entitled to get a second opinion and to go to reliable sources
Mhm.
and find out what all the options are before making
Mhm.
that decision. Don't let your healthcare professional make the decision for you. It's absolutely your decision.
Mhm. Mhm. In terms of those local thresholds, I just wanted to emphasize that like those thresholds sometimes change too, right? So it's very important that we are informed. It's very important that we know about our rights, we know about our situation, like as you said, doing our own research and asking for different information from the trusts, because that's kind of informed consent is about providing this information to all this information to women and birthing people so that they can make their own decisions. So I just wanted to agree with that point. Yeah.
Absolutely. So what do these findings, actually mean in practice
Mm-hmm, mm-hmm.
for women and birthing people, especially those from marginalized communities? How are they experiencing things on the ground?
Yeah, they were so like amazingly, very eloquently, people were reaching out to us and like filling out our survey. It was a great pleasure for me to read them, because how people explain their own experiences is always really amazing, right? So their direct voices, to hearing them directly. But like it was not very obviously it was not very easy, because people were sharing how they were feeling very unsupported, feeling ignored, and their choices being discarded, and how this kind of adds on to their distrust to the maternity care system that they already have. They were feeling like they were sharing that they were feeling like they were coerced into unassisted birth, for instance, which is a viable option, legal option. But people were saying that they were kind of forced into this decision because no alternative is provided to them. And we heard a lot about anxiety, stress, and tension, right? Like this is already, pregnancy is a dynamic process, things change, and there is a lot of uncertainty around it as well. But this is adding extra layer on very unnecessary and unneeded, like that can be actually solved, kind of extra pressure and stress for them, because in some cases they have to fight this battle with their trust until the very end of their pregnancy, and they cannot make sure that they are going to be able to access to this rights. Basically, they shared how traumatic it is, especially when there are last minute changes. It is very important. People make like plans, if they, especially if they have like older kids, if they have someone that they have to take care of, or if they don't have a lot of family and friends in this country. Let's imagine like a migrant family who has no one to take care of like the other kids, so they plan a home birth. But then like if you just like at the very last minute, if a trust encourage them or like tell them to come into the labor ward, then it creates a lot of traumatic impact. And they also shared how like empowered they felt when their choices are honored, when their choices is like provided to them. specifically with marginalized communities, again, like those clinical pathways and guidance on access to home birth too often automatically lock, especially Black and brown women and birthing people out of home birth options, and they share their frustrations on that. And women and birthing people with disabilities shared how hospital environments are not really suitable always for their specific needs. People share like deep, again, distrust, community level distrust to the system, which is something again came up in our systemic racism report too. 2/3 of our respondents were saying that they don't trust the system, they don't feel safe in the system. So this is kind of again adding on to that. And it's very clear that like who can fight this battle, right? If you don't have enough resources, it's really hard for you to fight this battle and to fight for your rights. If English is your second language, it's really harder for you to write a template, like to finish a template letter and to send it. So it's very important to consider those disproportionate impacts. And healthcare professionals too, they shared how like heartbroken they are because they are not able to do their job. They are prevented from doing like personalized care, and also they are not trained enough. Sometimes like some of them shared that they don't feel confident to go out and support home birth. But again, I just want to say that like not to leave on a pessimistic note here. We are not here saying that like this is not an option. This is an option and this is a right. And if people want to choose this home birth as an option, I encourage everyone to go and check our website, our resources and fact sheets and find more information. And they can always CC us as well or write to us at action@birthrights.org UK. And that's how they can reach us. And we are happy to provide more information. Yeah.
That's fantastic. And I assume you've got information on there as well for healthcare professionals, because you just touched on that. And I am just, thinking about the midwives. What can they do to sort of advocate for more home birth services within their trust?
Yeah, we have like two tabs on the website in terms of these campaign resources for women and birthing people and then for healthcare professionals, because they can also like, of course, it depends in your situation, your position within the trust, right? If you are like a senior level or junior level, but we really encourage all the midwives who want to fight for this at their own trusts, like to check out those resources. We encourage them to check out like some kind of they can look out for some allies in their trust. They can talk to the head of midwifery in their trust and just like show some like share information that we have with their trusts, right? Or they can write to they can receive trainings from us as well, because this is something that like this is part of what we do in the trainings too, right? Just like providing rights-based information, and we talk about these different birth options and how this is part of rights respecting care as well. So there are a lot of things for midwives that midwives can do too. So we encourage everyone to check them out. Yeah.
That's fantastic. We're always encouraging midwives to sort of lead the way and make change and say, anybody can do it. It's just, like you say, finding the right allies, finding the right people that will champion this. You have to do all the research, you gather all the evidence, find other trusts that are modeling this really, really well, get them involved, and just persistence. Basically,
Just
just keep going.
Keep going. Yeah,
Absolutely. And we always say, use other charities, find out their resources, because all the resources are there. Most of the time, you don't need to, spend hours on different research and stuff, because the charities have already done it. It's already there. They've got leaflets, they've got information that you can print off and present to the managers and the leaders that lead the way. So tap into all of our charities. So just going back to the home birth report, when we look at the bigger picture, how do the findings of that report sort of fit in overall to the UK's maternity system?
This was very interesting to me also because when we are doing the research and when we were thinking about the campaign, it's very clear that we are talking about home birth as an option and like place of birth, discussion around place of birth. But what I realized is that all of these themes about like feeling ignored, not being listened to, not respecting your like consent or informed decision making process, those things are actually like kind of all the things that come up in every other issue in maternity care system, right? So it is part of like what people are now calling like crisis in maternity care is actually these themes come up a lot in other areas as well. So this is part of the larger systemic issue, and rolling back of these rights actually have a lot of impact in that sense. One, like the first thing that I want to say is about it is really shocking to see how there is a fundamental lack of understanding about human rights and human rights in maternity care among decision makers. So it is very easy, it becomes very easy for trust to just like suspend services or restrict services, easier for them to think about this option. But this actually shows that this is when you are restricting these services, you are violating women and birthing people's rights, right? And there is a systemic failure to provide home birth as a meaningful option. And when you deny this, women and birthing people are denied access to this right. So it's very important that within the mentalities, within the practices, within all the decision-making processes, we embed this idea of human rights-based framework and understanding. Secondly, in the bigger picture, this is a major issue in terms of safety and bodily autonomy, as you can imagine, because these are chosen by women and birthing people because they are critical for them. They know themselves, they know their bodies, they know their own psychological conditions, previous experiences. That's why, for their own safety, they choose this. But being forced into the hospital and not being listened to about this right, about this choice, causes a lot of like long-term and psychological trauma and impact on women and birthing people. So it's very, very important when we are thinking about this issue, that like women and birthing people that I've been speaking to, and this is very similar with midwives as well, people want to have an agency and control in their own choices and decisions, right? This is our right as a human. So when you take away that right, and when you don't provide these services, don't provide any kind of other alternative like other options, and just like force people into certain choices, it's kind of taking away that agency and control. That's creating a lot of impact. And the last thing about like the bigger picture here is that there's a very clear reflection of racial disparities in maternity care in this issue as well. So as I said before, people don't feel safe in maternity care system because their bodily autonomy is not respected, their informed consent is not respected. That's why they want to make these choices. So kind of like the shift that I mentioned before about shifting from community-based care to the labor ward, to the hospitals, and dismantling of already working, effectively working home birth teams, kind of perpetuates this understanding and really reinforces the mistrust to the system by certain communities. So that's why like I encourage people to go and check out our recommendations as well, because what we clearly say that like there is a need for a systemic change here. So we ask governments to have a safe maternity care act, which is gonna like bring together all these issues: safety, accountability, freedom of choice, equity, all together. They have to be tackled all together. But then also with NHS trusts and ICBs too, they spend so much money on clinical negligence claims, and this money can be spent, these resources can be spent on other issues, like with the planning, with the staffing, with all other services. So it's supporting the healthcare professionals. So it's very important to have a very person-centered and personalized and personalized care, and then also paying attention to continuity of care, like, is very vital here. That's going to solve a lot of issues. Yeah.
Couldn't agree more. I really couldn't.
Mm.
So tell us a little bit more about what Birthrights have got coming up, because this report that you've done on home births is just so helpful. So thank you so much for
Mhm.
doing that and putting all the hard graft in and
Mhm.
presenting it for everybody to see.
Mhm.
But I know there's quite a few changes coming up in Birthrights at the moment.
Yeah, exactly. Yeah, we have made like experienced a change a couple of years ago, and now we are very like strong in our grounds in terms of we have a great strategic framework. We are implementing that. So yeah, we are now having a change with our CEOs, but we have a very dedicated understanding around everything now. We have all our plans, everything planned ahead, and we are very, this report and this campaign just like really enabled us a momentum. So we want to continue with this momentum, direct attention to these issues. That's why it's very important for us not to limit this with the home birth services themselves. They are very important, but just like look at the bigger picture and do campaigns around the bigger picture, around many other areas as well that are intertwined with this issue basically. So we are doing a lot in terms of to challenge these dismantling of dedicated home birth teams. We are planning some campaigning around like tackling these decisions and fighting for a change back to the community, basically, as the government actually promised. That's like shifting the care from hospital to the community. We are going to be fighting more on this as well. We recently have a survey for midwives because we wanted to understand like their training on these different kind of birth options and how they are supported, how they feel in their work conditions, and it's very, again, unfortunately, very heartbreaking picture that's coming out of that. And soon we will share more findings on that as well, how they feel unsupported and in terms of their job prospects, or even if they get a job, then in terms of like career progression. And again, this ties well great with the community-based care understanding. So really, this is really, we are constantly pushing for the Safe Maternity Care Act. So there are a lot of very exciting things waiting for us, and we really want, like, this is a very important moment. There is a great attention on maternity care services, right? But it is very important not to be pessimistic about it, but just like come out of this in an empowered way, like with collaborative, collective action all together across different communities. And I'm hopeful in that sense as well. Yeah.
Definitely. Yeah, we are very busy and doing such wonderful work. And you're absolutely right. If we know what the problem is, let's talk about the problem, and then we can talk about the solution, right? We
Yeah.
can talk about how to make a difference and make it better, improve outcomes.
Yeah.
Well, thank you so much, Elif, for being with us today and telling us all about your findings and your work. It's absolutely fascinating. We're huge supporters of you guys. And I really encourage everybody to go to the Birthrights website and check out the findings of that home birth restrictions report.
Yeah, thank you so much for having me, for this opportunity. It is great to reach out to all the women and birthing people out there. Thank you.
Thank you for listening to this episode of the Mama Podcast. If you'd like to find out more about the life-saving work we do, you can go over to our website at www.mamaacademy.org.uk, or you can follow us on social media at Mama Academy. We're on Instagram, TikTok, Facebook, Pinterest, all of your favourite social media sites.